Assalamu alaikum wa rahmatullahi wa barakatuh. On behalf of the Imam Mahdi Association of Marja'iyya, I would like to wish everyone Ramadan Mubarak. May all of our efforts in this blessed month attain its closeness to our Creator, provide us with great rewards, and hasten the appearance of the Imam of our time, Imam Sahib al-Asr wa Zaman. As the negative impacts of COVID-19 continue to devastate our communities, it has become increasingly important to stay well informed in order to protect ourselves and our loved ones. Due to the great prevalence of misinformation, misconceptions, and misunderstandings that exist regarding the COVID-19 vaccinations, we have formed this webinar in order to educate the Muslim community on the importance of getting vaccinated and to provide our community members with the opportunity to ask their most pressing questions to our well-respected experts, as well as present the religious authorities' point of view on the matter. First, we will start off with a Quran recitation. Next, I will properly introduce our well-respected speakers, and they will briefly touch upon the importance of getting vaccinated. After which, our leading scholar, Sayyid Kashmiri, will present the fatwa and religious instruction by His Eminence, Ayatollah Sayyid Ali Sistani. And finally, we will conclude with the Q&A. Without further ado, let's begin. We could start with the Quran recitation right now.
بسم الله الرحمن الرحيم شهر رمضان الذي أنزل فيه القرآن هدى للناس وبينات من الهدى والفرقان فمن شهد منكم الشهر فليصمه ومن كان مريضا أو على سفر فعدة من أيام أخر يريد الله بكم اليسر ولا يريد بكم العسر ولتكملوا العدة ولتكبروا الله على ما هداكم ولعلكم تشكرون.
What a lovely recitation that was. Okay, now I would like to introduce our well-respected physicians, Dr. Ali Hassoun and Dr. Shehla Naqvi. Dr. Shehla Naqvi is a pediatrician who is trained in infectious diseases and has spent 18 years in laboratory and clinical research in St. Louis University, State University of New York, and Aga Khan University. She has published her research on respiratory viruses and intestinal infections in some of the most esteemed and renowned medical journals. She is presently associated with City University of New York and practices in Bronx, New York. Dr. Ali Hassoun is a clinical associate professor at the University of Alabama at Birmingham School of Medicine, Huntsville Campus. He's an infectious disease and HIV specialist. Dr. Hassoun earned his medical degree at the University of Baghdad School of Medicine in Iraq. His internal medicine residency was performed at New York Medical College and Mount Vernon Hospital, New York. He was awarded a fellowship in infectious disease from the Long Island Jewish Medical Center in New York. Dr. Hassoun is a veteran researcher and the infection control director for Huntsville Hospital. In addition to being a reviewer for several medical journals and the BMG group, he's published many articles and authored book chapters. Among many awards over the years, in 2019, he received the Janet Donahue Red Ribbon Award for exemplary service as a health professional in the fight against HIV/AIDS, and most recently named Huntsville Hero for leading the COVID-19 management in Huntsville Hospital Health System. And I would also like to introduce the highly respected and renowned Islamic scholar, Sayyid Muhammad Bakr Kashmiri. Sayyid Kashmiri comes from a renowned family recognized for their high levels of education, piety, and dedicated service in supporting the Muslim community. Sayyid Kashmiri completed most of his religious studies in Iran, beginning in the holy city of Mashhad, and later continued in the holy city of Qom. The Said studied under the guidance of some of the most prominent teachers of the past century and is the official representative of the world's leading marja, His Grand Eminence Ayatollah Sayyid Ali as-Sistani, regarding all matters pertaining to the jurist in North America. As a writer, author, and lecturer, Sayyid Kashmiri has participated in numerous activities and projects throughout the years and has published many Islamic works. As the founder of the I.M.A.M Association of Marja'iyah, the Sayyid continues to greatly benefit the Muslim community, provide us with wisdom guidance through these difficult times. Assalamu alaikum, everyone. How are you all doing?
Wa alaikum assalam.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
It's a pleasure having you all here. How's your Ramadan going?
Oh, alhamdulillah. It was good.
I'm hungry. Can't wait to break my fast.
Too early.
Too early? Oh, no, I don't think so. Anyways. Okay, so let's start off with the first, let's start off with the Said. Let's start off with a little presentation from both of the doctors. I'll just ask them a quick question and they can kind of just present their opinion on the COVID-19 vaccination. And then after that, we can have Sayyid Kashmiri present his fatwa and the religious instructions. So I was gonna ask you guys, is the COVID vaccines safe for everyone or not? What is your opinion on the matter? And do you think that it is necessary for all of us to get vaccinated?
Sister Dr. Naqvi, you want to go ahead? Start.
Can you hear me? Okay.
Yes.
Nothing in the world is ever going to be safe for everyone. But the way this vaccine is working, there have been like no more than 2% people who have had any kind of allergic reaction. Majority of them were really minor, 0.025, that is percent of the people required any treatment. So this means that as far as allergic reactions to the vaccine, immediate allergic reactions are minimal. And this has about as safe a vaccine as you can make. There are always individual variations. People have underlying problems. Everything can never be predicted. But I don't think we could make a safer vaccine.
Yeah, and I agree 100%. So, you know, as a safety, it's been shown whether in the studies or in real life now, as more than 200 million receive the vaccine, it's definitely been shown safe. There's always, with any medication or vaccination, there's going to be some side effect associated with it. But whatever we've seen at the moment is expected. It's not unusual. And even with what you see on the media and discussion about recently the J&J vaccine, for example, that level is like at 5 or 11 per million is extremely low in compared to what the COVID-19 disease can be an issue and can be a problem. So I think everybody should get the vaccine.
It may turn out it's lower, but right now there is 1 chance in 500 of dying of the disease, whereas 1 chance in 1 million of having a severe problem with the disease. So therefore, people should understand that the risk is low, the benefits is high, and that even in pregnant women, the vaccine has been found to be safe for them and safe for their unborn baby, whereas pregnant women fall into the category of getting more severe disease than others. It is safe for women who are breastfeeding. In fact, their immunity is passed on to the babies in their arms that they are nursing. So we, from the pediatric point of view, this is the 2 things that I addressed, that is safe in pregnancy, it is safe in lactation, and only 1 vaccine has been approved for 16-year-olds, and obviously pediatrics ends at 18. So therefore, we really are encouraging our 16 to 18-year-old pediatric patients to get the vaccine.
Wow, that's great. That's great to hear. I would like to ask the both of you real quick, what message would you like to send to the community members out there who are hesitant to take the vaccine, who maybe don't trust the vaccine and don't trust the word of medical experts.
Would you like me to go?
Yes.
Yes.
The interesting thing that I want to say today is that I will not reveal any secrets. I will not tell you anything that you cannot access just by opening up the computer and get everything out of it. I went to the CDC website. Occasionally, it connected me to the FDA websites. Everything was written in very easy to understand English. Very clearly, they wrote out the questions that people frequently ask and then answered them. So I realized that this has been a time when the medical profession, the pharmaceutical companies, and the government have all been very transparent and open about sharing information. Because when you don't have real information, then the conspiracy theories start taking root in the community. So to not allow that to happen, they have tried to share as much information as possible. That's why you find out that 7 million people received J&J vaccine and 8 of them developed a serious complication. Otherwise, this was such a minor thing that you may not have heard. So the fact that everything's available on the web, anyone who can read English can really access it because they're not putting it in like a serious medical jargon that nobody will understand. It's being written in very clear, concise, and they actually have written questions. Do you want to ask this question? Do you want to ask this question? And then you can go one by one and ask them. So I'm happy to say that I have no new news. Everything is online.
Yeah, and what's very important to understand, a lot of people say, well, this developed pretty fast. They just want to give it to us and see how things go. The reality in all the studies that's done on the COVID-19 vaccine, there was no cut corners. Everything followed the right way. Everything done the right way to make sure and ensure safety and efficacy is checked and looked at. So even though it was done in a shorter time, it was done in a shorter time because we were able to do certain steps in parallel in compared to what we used to do, waiting each step happening over a few years. This was done in parallel because we were living in pandemic. There was funding for it. There was volunteers who will do it in that. And the studies enrolled 40,000 people, 30,000 in another. So there was a good number where it got enrolled, and everything followed and looked at where it's not just the drug company released their data. No, there was an independent board looked at that to make sure it's safe. And after all this, the CDC and the FDA independently reviewed it as well and make sure it's safe. So there's a lot of steps that's done and looked at. And after the release, like what Dr. Naqvi said, there's a specific vaccine safety group who look at it and follow it. And that's why the J&J wanted to release within 2 to 3 weeks. When they heard about something going on, they looked at it quickly and say, look, let's dig deep in these cases and make sure everything's safe. So what's working and what's looking, how things going, it's everything safe and everything done the right way.
That's great to hear.
Just because there's a word, the label of messenger RNA, people got confused because RNA is close to DNA. I'm actually heard American friends say it will alter our DNA. And I said, no, there's no relationship to DNA can alter RNA. RNA can never alter DNA. So, I mean, these are like, because it's a new word, people have started like concocting things out of it. And as the doctor said, that this process was had been perfected before for other vaccines. It was just not needed. And so the system was already, and the researchers just plugged into it, and the government threw money at it like it was a world war. Like after, in the Second World War, American industry just bloomed and they started making thousands of bombs to kill people. Similarly, they threw money at it and they started creating millions of vaccines out of it.
SubhanAllah, it's amazing what we can do when we actually try to do something good for once, right? Like this vaccine for the global pandemic. It happened quickly, like you said. Now I would like to invite Sayyid Kashmiri to present the fatwa and the religious instructions.
Sayyidina, we can't hear you. You are on mute. Actually, there's a question that I presented over here. After your permission, Brother Ali, if you may read it. Thank you.
بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا وحبيبي إله العالمين أبي القاسم محمد وآله الطيبين الطاهرين. May Allah accept your fasting, prayers, and all good deeds in this holy month of Ramadan. Thank you, Brother Ali, for your coordinating and handling this beautiful session. As well as I would like to thank Dr. Shehla and Dr. Hassoun for the wonderful explaining and giving clear and precise answers that really concerns everyone. And we are honored to learn and get education from both of you. Thank you so much. And as well as I would like to thank I.M.A.M team for preparing this session to serve the community. As far as the religious aspect, actually, we can talk in general. We have foundations rules amongst the Sharia we can use, but still the opinion of Ayatollah Sistani here is very essential. You know, many people, they ask about can we take vaccine while we are fasting? Some other people asking initially, is it obligated to get vaccine or not? Here is the situation. Let me put it in this way. It is not only permissible, it is definitely not haram, it is definitely not makruh, but at least it is not only permissible, but also it is encourageable. It is encouraged and recommended by the jurists, including Ayatollah Sistani, to receive vaccine of COVID-19. Not only that, but also maybe it becomes obligated in some situation due to the nature of the pandemic and the social responsibility. We meet people, we sit down and talk to others, and there's easy way we become part of the problem and so spreading the virus to others or getting from others. And this is really, as we hear from doctors, is a killer virus. So in some cases, for some individuals, it's become not only encourageable, not only recommended, but also unobligated. So let me summarize it. It is permissible to take it while fasting, and it is encouraged by fuqaha jurists, and in some cases, it might be become obligated on you to take vaccine. Now, the question is, what about during Ramadan? Some people fasting and they want to take vaccine. Is it okay in case we assume or we know, we are sure it will side effect us? As we hear from professionals, experts, usually the second shot, it brings some side effect like fatigue or illness or difficulties to continue with your normal day, normal activities. While fasting, it will become very hard to continue your fast. The religious answer, again, by the Sistani, may Allah prolong his life, is even though you assume or you know that will make some side effect on you, it is recommended And maybe sometimes it's obligated on you to take the vaccine while you are fasting. Now, another question maybe will come to us and ask, what should we do in that case? Again, we go back to the normal and basic rules. If you face, God not willing, some difficulties after getting vaccine, that's fine. If you cannot continue your fasting, break your fast. Break your fast. There's no issue with that, no religious issue with that. And later you can make it up, and there's no kafara on it, definitely. Thank you so much. In case there's a question regarding this fatwa or something else related to religious aspect, I'm here until the end of the session to answer the question. Thank you so much, and Jazakumullah khair. I personally took the first shot.
Thank you so much, Sayyidina, for those wise words. Yes, because as Muslims, we do have a responsibility to our fellow community members as well. We have to safeguard their health and well-being just as much as we have to do for ours. So if taking the vaccine can help prevent the spread and save lives, then it becomes a responsibility of ours, like you were saying. Now I'd like to move on to a couple questions for the physicians that are present. The first question, which was asked in the chat, is it possible to get COVID-19 after being vaccinated? I'm going to first ask this question to Dr. Hassoun, and then we'll alternate.
Sure. So, yes, you can, because the vaccine in general, they are not 100% effective like any other vaccination. It's actually, the COVID-19 vaccine is considered and compared to others is the most effective because the Pfizer and the Moderna is about 90 to 95% effective. So it's not 100%. So there's still a chance. But remember, whenever we give a vaccine, the idea from the vaccine is we reduce severe infections. We reduce hospitalization from the infection. We reduce death. And in all these three, COVID-19 vaccine have proven it's effective. It's actually for severe disease, it's 100% effective. For death as well, 100%. So you might get mild symptoms, you might be asymptomatic, but will prevent all these other things.
Thank you so much, Dr. Hassoun. Dr. Naqvi, is there anything you would like to add?
Can I follow up on that? It's very interesting. Like I know a doctor who was immunized, but then she got a very massive exposure. Like the person she was attending to was seriously ill. So must have been letting out a whole lot of virus in his breath. And she was very close to him during care. And she got it, but she got a very mild case. So it is also that it depends on how much virus goes in you. So in this case, right now, everybody's saying, get the vaccine, but wear the mask. That is why it is being said that if you minimize the amount of virus going in you, your vaccine will be even more protective.
And to add more, people need to understand the chances of getting infection, like I talked, we're talking about those who's fully vaccinated. But if you have one shot, your chances will be some higher. The moment you get the 2 shots, it will go down significantly. And I've seen it personally in the hospital. People, get 1 shot and they think everything gonna be okay. They're more relaxed. They don't follow the rules. And if they do that, you still can't get the infection. You still can't get problems. So when we're talking about vaccination, it's full vaccination, 2 doses, and you wait at least 2 weeks to 4 weeks from the last shot. That's gonna be the most protective time for you.
Thank you so much both for those answers. So you can still get infected by the virus, but the severity won't be as intense as opposed to if you were unvaccinated. So if, let's say you are fully vaccinated and you've waited 2 weeks afterwards, so you should have a strong immunity against the virus. Do you still have to follow all the same safety protocols like the social distancing and wearing masks? You guys can elaborate more on that, please.
Dr. Naqvi, you want to?
One of the ideas is that you cannot create this thing that I'm going around without a mask because I've been vaccinated, which means we take away this thing. Everybody has to wear masks, and so it's easier. Otherwise, how am I supposed to have it tattooed on my forehead, vaccinated, that this person doesn't have to wear mask? One reason is this. The other reason is that even if you are immunized and you get a huge dose of virus from some sick person, you might fall ill. So it's best to minimize the virus getting in you also by wearing a mask.
So one comment about that is, I know a lot of people is tired of keep wearing the mask. They're tired of following the prevention guideline. And I can tell you this, with time, we're going to be able to get rid of it. But the current situation, we continue to have active transmission of the virus. And because of that, we need to continue doing what we're doing. The moment we can reduce the cases to a level where there will be really minimal chance of transmission. And when we say we reach that level, it means mainly by vaccination, where we get to herd immunity by vaccination. Then we might be able to say, you don't need the mask. You don't need to do, the physical distance. Now, a lot of people also will say, but then what's the benefit of all this? And I can tell you there's significant benefit currently from vaccination, even though with wearing the mask, because you can go out and meet with people who's vaccinated and get close together. You can share and be outdoor more, definitely. Even in close spaces, you can be there because your risk will be much, much lower. And the idea all goes back to, if we leave this virus keep going, we're going to get into trouble with another surge, with another problem. So be patient. Alhamdulillah, we always say, as-sabr miftah al-faraj. It's gonna be time where we'll be able to open it up with being patient, but give it a little bit more time, but get vaccinated as soon as you can.
So at this time, we have like 30% people in the United States who are immunized, fully immunized, let's say. 89 million people seem like a lot, but that's less than 30% of United States population. 135 million have received at least one dose. So, I mean, we are getting there, but we are still very far. And we are trying to hit a target of like 70% people immunized before you start calling for thinking that there is enough immunity in the community.
How long do you expect before we can actually reach that mark of 70%, realistically speaking?
Well, they gave 200 million, 2 million vaccines, 200 million in the first 100 days. So the whole thing is that the population is stratified. The college educated people are getting the vaccine the most often. The elderly and weakened immune system people ran out to get the vaccine first. The people attending to them got the vaccine. Who is trying to not get the vaccine are either they have less education or they are young and they think that they will, shake it off. It will not affect them. Unfortunately, a good 30% of people 4 months after the virus complain of still feeling weak, is still feeling like foggy in their thinking, and 20% were having more symptoms with that. So, I mean, this virus is not going away without leaving some side effects on people. So I think this, death is one thing, and continuing to feel sick for 4 months or more is definitely a big deal. So young people should not avoid the vaccine because they think they are young and they will not get severe disease.
So my expectation actually, probably it's going to be July or August if, and this is with if, because it really depends a lot on our behavior and what we do. One, we're going to need to keep up with the prevention part. And two, we're going to get vaccinated as soon as possible. If we do that and we do it efficiently where we get everybody, and that's really another thing is very important too, is to outreach to everybody who is hesitant and still thinking about it, to try to get them to do it. Because if we can do that and we achieve, let's say 70%, 60% from immunization, herd immunity, another 20% who already got infected, we can probably by July and August. But it really depends on our behavior and what we do.
Inshallah, that would be great. We can actually reach that mark by the end of the summer. So we can kind of start lifting some of these mandates and go back to normal living again. So now I wanted to ask you both about the long-term side effects of the vaccine. So we've talked about some of the short-term side effects and how you both believe they're nowhere near as serious or dangerous as the actual virus. And it's much better to get vaccinated than, risk a week in bed, for instance. What about the long-term side effects? Because there's a lot of talk about the potential dangers of the long-term effects and consequences of these vaccines. You guys can please elaborate on that.
Sure. So I'll take that, Dr. Naqvi. So that's an interesting. There's, in my opinion, there is really no long-term side effect or problem from the vaccination. But we know for sure there is long-term effect from the infection. The vaccination in general, and the COVID-19 vaccine included, when you look at them, if you develop any side effect, it's gonna be really within the first 2 to 4 weeks. Maximum, it might be 2 months to 3 months if there is any issues with it. But it really, in general, will be the first 2 to 3 weeks if any issues comes up. So there's no such thing called long-term side effect. I know a lot of people talk about it. A lot of media talk about it. But in general, vaccination, including the COVID-19 vaccine, there is no such thing as there's going to be a side effect that might show up 6 months later. Because the vaccine itself, when you put it in your muscle, it's going to be taken out of the body within 10 days. It doesn't stay there anymore. It's gone. There's no residual, nothing in there anymore that will have any particle left in the body from it. So again, there's long-term effect from the infection, but there's no long-term side effect from the vaccine itself.
Very well said, Dr. Hassan. I really appreciate how well you said it.
Thank you.
Thank you so much for your answer. Yeah, with all these rumors going around, it's really hard to differentiate what's fake and what's real. And we're lucky to have you two physicians here to explain it to us and give us the reality behind the situation. Now I wanted to ask you guys about the vaccines that are available. We have many different kinds on the market right now. We have the Moderna, we have the Pfizer, we have the Johnson & Johnson. Which vaccine is the best and which one do you guys recommend? This is a really common question. I would love to hear an answer from you both. Starting off with you, Dr. Naqvi.
Well, the answer is whichever one is available. They all seem to be effective, and J&J, because there's some concerns about younger women not tolerating it, having some serious side effect. Maybe they could choose not to take J&J, but Moderna and Pfizer are both equally effective, equally safe. Both require 2 doses, one after 4 weeks, the other after 3 weeks. So this is a main thing, that whatever is available is good for you, please take it. But with the recent conversation about 8 cases of problems with J&J, which all occurred in young women. By young, I mean they were not postmenopausal women. And it's possible that they were taking birth control pills. I have not received full information. So the problems were with clotting, and birth control pills also cause clotting, and all the cases occurred in younger women. So it's possible that we were having some other things acting at the same time. So otherwise, all 3 safe and all 3 effective.
Yeah, and I agree with that. So, you know, one thing people need to understand, science evolve and change with time. And we've seen it over the pandemic. At this stage, all these vaccines seem safe and effective. Could this change in 6 months? And one part of it is because we're going to have more data and more information. So I would say definitely if you get to have Moderna and Pfizer or J&J with certain precaution, like what the FDA now said, because you know now the CDC yesterday in their meeting said you can resume using the J&J. There's some warning about a certain age group, but it's okay to do it. And my thought, probably the FDA gonna say the same. So we're gonna have all of the three back in. I'm more toward probably the 2 shots is better in the way of getting against the variant and how much you can fight it off. But J&J was thinking about that anyway. So whatever you get at the moment, it's great to do. This can evolve later on because we have much more vaccine available, much more doses available. We might end up saying, well, for this age group, do this, for this special group, do this. But at the moment, from everything we have, you can get any of them.
Okay, that's great to hear because we have many options available right now in many communities. So it gets confusing on which one's the best. But like you guys said, pick the one that's available so you can get it the earliest as possible. So now I have a question for you both about these new variants in the virus. We have the UK strain, we have the Brazilian strain, and they seem to be way more dangerous than the previous strains that many people were exposed to. Are the current vaccines that we have able to protect us against these variants? And will there be a need for a booster or a third vaccine in the future?
Yes. So the current vaccines that's available, all of them are effective for the variants. Now, could there be a new variant coming up and would be a different story? Yes. That's why we want everybody to get vaccinated, because the current status, all of them is effective. All of them should be fine to fight the variant. Could there be a booster? Yes, as well, because, you know, again, we just talked about, it just depends on our behavior. Human behavior has been very tough and challenging. And I can tell you as a physician, frustrating sometimes, because a lot of them resistant to follow the guideline and the prevention. And because of that, we continue to have issues of the virus ongoing. So if that's issue of the virus continue ongoing like this, we probably gonna need a booster for the probably for the next few years coming. And it might need to be like what we do the flu shot once a year, that we do it around fall or October or winter.
We're not talking about the whole world. We're really trying to concentrate on the United States. Obviously, there are many other kind of vaccines which are being used in India, China, Russia. So there are other vaccines also available, and we don't know in reality. They have not been tested like the ones we are using. So our system is very, very rigorous about testing for safety and efficacy. So for sure, we can say this for the 3 vaccines that we are bringing up today. What we need to understand, why we keep saying a lot of people have to be vaccinated. The more activity you have in the community, the more people have the infection, the more virus is multiplying. The more it multiplies, the more chances it will mutate into a different kind of virus. So there are many, many good reasons for why everybody should vaccinate. And one of the things would be that these vaccines will continue to protect us.
That's great to hear. And it's good to understand that the more people are vaccinated, the less likely that there's a chance of the virus mutating and we getting these alternative strains that can cause some serious harm to us. For the next question, I want to ask about children. And I know, Dr. Naqvi, this is your field especially. Will young children or children of all ages ever need the vaccine?
We give, let's say, a flu vaccine to all the children, and we have no harm. But every time a vaccine comes in, you weigh the benefits against the possible risks. So because it seems to cause very mild disease in children, and I have had 2-month-olds and 4-month-olds who basically came with minor colds, and the only reason we tested them was because the parents were having COVID. It turned out child was having COVID too, and had absolutely nothing more than a sniffly nose. So the risk to children is from the disease seems to be way less than even teenagers, I should say. So therefore, the chance that really young children will be getting this vaccine is far in the future. We don't see a need right now.
Yeah, and I would say it depends on the age group as well. So the age of 12 to 16, data-wise, it's been shown they might be at risk of transmitting to others more in compared to the younger age group, 8 and below. They don't transmit as much. That's why most of the studies currently that's running, it's actually running on the 12 to 16 or 10 to 16, because that's where they see the most possible benefit that get into in there. Of course, we're going to need to wait and see how safe and efficacious. I don't see there's going to be safety issues with it, but again, you look at the benefit. I suspect for that age group, it's going to end up need to be, but the younger, just depending on what's available and what's the data on.
Yes. I was basically quoting Cody Meisner, who is a pediatric infectious disease specialist, who said that for the time being, I think 12 years is a good age after which they might want to immunize, but not younger than that.
Okay, thank you. If you have contracted COVID, you tested positive in the past, is there any benefit to taking the vaccine? Or do you have a strong immunity? There is? Can you please elaborate?
Oh, Dr. Hassan, you want to handle
Yeah,
that?
so definitely yes. So, when you get COVID-19, it will be certain type of the virus, one. And the other part is your immune function might be remembering that infection for 3 months, could be up to 5 months, but it then wean off and we didn't remember that. So if you get exposed to it, you can get the virus again. And I've seen people where actually got the infection in December, resolved, and then they got another infection in March and April again. I actually have seen people who got it in January and they got it again end of February.
Wow.
Part of that also, remember, sometimes it's not just the original virus, it's the mutated virus where we did not develop immunity to it. So you definitely can get infected again, whether with the original or with the mutant. And it can be severe cases when you get the second infection. That's why the vaccine will make the difference, because the vaccine, you might need to wait when you had COVID infection, wait about 6 to 8 weeks and get the shot, because it will protect you from getting the original virus and the mutant virus. And the immunity itself actually can stay at least 6 months. It might be up to a year even, in compared to the regular infection that you get.
So to summarize, if somebody has had the COVID disease, they should wait for about 2 months and then receive the vaccine, both doses. And surprisingly, some of the people who were still struggling, as I said, up to 4 months, people were complaining about symptoms, post-COVID symptoms. When they received the vaccine, they actually felt much better, much faster. That is, it probably, the vaccine invoked the kind of immune responses which took care of their post-COVID symptoms.
Okay, thank you so much. We have a couple questions coming in the chat. One of the questions was talking about, you guys discussed how the vaccine was safe for pregnant women. Is there any clinical research to support this?
Yes, of course, nothing, just please understand, this is a very, very security conscious society where people are always afraid of being sued. Government is afraid of being sued. CDC and FDA feel they can be sued. So they never put out a statement till they have something to back it. So it is safe for pregnant women because pregnant women took it and were responded properly to it and did not have side effect to it. In spite of that, they have made an app for pregnant women that if they receive the vaccine, they can download that app, and in case they feel anything happens to them during pregnancy or after, they give their input to the government, so that there's an ongoing review of the safety.
Yeah, so definitely, the studies initially, the design of it, that when they enrolled the Moderna and Pfizer was excluding pregnant, but it happened to be, and this is the natural thing, patient got the first shot and some of them did get pregnant. So in this studies itself, there was hundreds who got pregnant with no safety issues or problem. And then after the studies and after approval of the vaccine, there's actually thousands and thousands of pregnant women got the vaccine without any safety issues or complication or effect on the baby. What I usually tell my patients about this, look, if you are, in pregnancy in general, we want to avoid anything in the way of medication, treatment, anything, because in case it affects the baby. But what I usually tell them is, if you are at risk of exposure, if you live in a community where there's continuous exposure and you're at risk of exposure, you get the vaccine. Because if you get COVID-19 infection, your risk of complication, if you're pregnant, is higher. Your risk of death can be higher. And then the treatment that we can give you for general population who had COVID-19 is limited because it might affect the baby. So you better get vaccinated, get immune, and avoid the infection, and don't get into the trouble of getting all these issues of COVID-19 infection, and of course, problems.
And the sad thing is that they are also at higher risk of losing the pregnancy.
Yes.
If they get the COVID-19.
Thank you very much for your answers. So you both have discussed how after 6 months to a year, your immunity can start to wane and it can start to decrease and we won't be as protected against the virus. Would we have to take another vaccination after that point eventually? Is that inevitable if the virus keeps multiplying as quick as it is and spreading across the country?
Yes. Dr. Naqvi?
Yes, sir. I mean, I would happily go and get another shot.
Yeah. I'm waiting for September, October to do it.
Oh, wow. So you're already planning for it then. Way ahead of us.
No, we're not planning. Again, the idea is it really depends on our behavior. If we can control it and it's gone, it's done. We don't need it. But from what's going on at the moment, it looks like we're gonna need it sometime in the winter.
Okay, thank you. So what is a good resource for information about the COVID vaccine that we can trust? What are the good sources out there that we can rely on? Because there's so much misinformation.
Just to look up everything before this, I researched all the things available. CDC website will be the easiest. All you have to do is type COVID vaccine in your computer and the things which open up are CDC. Go to CDC, each vaccine is described separately. The questions in your mind are already there and you can click on them and get the answer. Generally, most local health departments are doing it. Like New York City has its own. The county I'm in has its own. So these may be more easy and they might tell you where to go and get the vaccination. So For general information, I think I found the CDC one to be easy to understand, easy to access, and I would really encourage everybody to see that. But if they want to find out where do I get it, go to the local. In fact, that's another thing. You say, COVID vaccine, where can I get it? And you will come to the answer with your zip code.
Yeah, and definitely the CDC website is very, very helpful, and actually helpful for patients and physicians. And in addition, our society, the Infectious Disease Society of America, have their own website, and they have their own education materials specifically about COVID-19. And actually, it's idsociety.org or the cdc.org. You can get it easily on the web. And you just type COVID-19 and you'll get a plethora of information.
Brother Ali?
Yes.
If I may, from my perspective, from religious perspective, also I would like to add here to our beloved community members, when it comes to religious also, people ask questions and they have hesitation. For example, please go to the main source, go to the website of your religious authority, your marja you emulate to, or his representatives or his offices only. Because I noticed here and there, some clergy, some muballighin, they maybe explain something from their behalf, from their understanding, personal understanding. We can't follow any scholar, we can't follow any clergy. We have to follow the religious authorities who are qualified to be emulated. Thank you so much.
Thank you.
Thank you so much, Sayyidina. Yes, if you have any questions regarding Sayyidina Ayatollah Sistani and his rulings and his opinions on certain matters, then it's best to go to the I.M.A.M website or to contact the proper religious authorities, because anywhere else you go to, you'll probably get misinformation. Like we've seen with this virus right now, there's misinformation everywhere, especially on WhatsApp and social media. It's like every time you click on something, it's some sort of ridiculous theory or some, I don't even know, some kind of weird side effects people are talking about, and it's crazy. So Dr. Naqvi has left, but I'm pretty sure she'll come back soon, inshallah. So I'm gonna address these questions to you, Dr. Hassoun, in the meantime.
Sure.
So one question that I've received is that there's talks about mixing vaccinations, and if that's ineffective or effective. What do you have to say about that?
So, currently there's nothing published about mixing the vaccination, but I know for a fact in the UK, they running studies of giving AstraZeneca vaccine, which is from the United Kingdom, followed by the Russian vaccine, which is called Sputnik vaccine. In Germany, they actually have done AstraZeneca vaccine followed by the Pfizer vaccine. But there's really no good enough information about doing the mixing. In the United States, currently, we don't need that because it's readily available, all vaccine doses and stuff, and it's not recommended to do interchange or mixing things up because, again, we don't have that information.
Thank you so much, Dr. Hassoun.
I think Dr. Naqvi is there. She raised her hand, but I don't know how.
I think she is trying to reconnect. Brother Jihad, can you give her access, please?
Yeah, all right. All right, Brother Ali, you can go ahead if you want.
Okay. If someone, they have COVID already, can giving them the vaccine do anything for their side effects that they've experienced or not? It wouldn't really do anything.
So from my personal experience of seeing people and giving advice, if you take it 6 to 8 weeks later, there shouldn't be any issues. There shouldn't be any problem. There shouldn't be any worsening symptoms or worsening side effect. There shouldn't be any.
The vaccine won't be able to improve your side effects or help you. Can it improve your immune system and help it fight against the virus? If you, let's say you've contracted COVID and you decide to go get a vaccine that day and you're already feeling ill, can the vaccine help you in any way?
It really doesn't, because for the effect of the vaccine to happen, it takes about 2 to 4 weeks to be beneficial. So if you got COVID-19 today and you're trying to get the vaccine, there's no benefit out of it. One thing always comes up and asks question about, oh, I got my first COVID shot and then I get the COVID-19 infection. What would I do? I usually tell them, you just keep your usual schedule. So, because we're telling people if you get COVID-19, wait 6 to 8 weeks. But if they already had the first shot, go ahead and get your scheduled second shot at 3 weeks or 4 weeks. It shouldn't be an issue at all.
Thank you so much, Dr. Hassoun. I believe that's all the questions that I have and all the questions that we've received. So I guess we're coming to the end of this webinar. It was very educational, and alhamdulillah, we've got some great information. Would you or Sayyid Kashmiri like to add anything before we end?
Thank you so much. I really appreciate it. And thanks for Dr. Shehla and Dr. Hassoun for their valuable time. And it is weekend, we know. But this is for the sake of Allah subhanahu wa ta'ala and serving the community. Jazakumullah khair, and thank you everyone. Thank you, Ali, for your beautiful moderating.
Thank you, Brother Ali. Thank you.
Thank you so much.
Assalamu alaikum.
Take care.
Assalamu alaikum.
Assalamu alaikum. Thank you.